I welcome you all for this event. And it is really a pleasure that you all could make time and come here. As we had this inaugural session where the Honorable Governor and Honorable Vice Chairman SETU Aayog mentioned that healthcare system across Pan-Himalayas have similar challenges. They have similar issues which need to be tackled, and how can we tackle them together? That is the main idea behind this panel discussion as well. We have guests from Sikkim. Thank you, sir, for coming. And a ma'am here who's again leading one of the leading medical education institution. So I would like to just give a brief of what we are looking at in this particular session. One is how can we design the healthcare system in the Himalayan states different from the plains, and what are the major areas which we need to focus, like one could be the human resources, the other could be technology adoption, and also how could we maybe create preparedness for emergency systems. So these are 3-4 areas which will be our focus while we are discussing. So maybe I can start with Sharma sir and understand. Sir, you have been working in Sikkim, and the healthcare system at Sikkim has similarities with Uttarakhand. How would you like to suggest that what could be the better governance practices, or if you have adopted some other best practices which really worked well for strengthening the system in Sikkim?
Thank you so much. Good afternoon, everyone. So I'll start with Sarve Bhavantu Sukhina Sarve Santu Niramaya. We are in the path of making all health system a better system. So regarding the governance, what I would like to suggest is when you have a smaller state like ours, if the government is committed, I can cite one example. Like when the TV food basket system was introduced, my chief minister was the first to sponsor 200 people, 200 TB patients for the food basket. So here what I mean to say is when the government is convinced about the programs and the ways and means of helping the public in health sector, then definitely that would be a easiest way to improve the healthcare system in the periphery.
So, sir, like you mentioned about government being more proactive, holding as a sponsor or maybe a patron to improving the healthcare system that can improve the monitoring or maybe even the deliverables and impact of the healthcare system. So other than the example that you gave, are there any other specific things that have been done which are different from the plains? Did you adopt any other practice?
Yes, madam, whether other states have practiced or not, now what we are practicing is since the rainy season for April, May, June, July, and so early part of the August would be totally blackout in hill areas. So when you talk of high technology like drones and all to reach the what you call logistics and vaccine delivery system, that also doesn't work due to the weather situation. So now what we have adopted is we have now trained the students right from the secondary level for all the health programs. We have now imparting them in school health curriculum, and we are training the local youth. But the biggest problem with the local youth is, I think this is the problem faced by all the people sitting here from different states, that now the youth are migrating from the border areas to the developed areas. Now this will be a very big challenge for us in the days to come. That is what I feel. Because all the youth are moving means only we'll have a geriatric population, and whenever we have a disaster, like we had a Govt in Sikkim in 2023, and still we are facing the problem. We are not able to renovate all the infrastructures. During that period, these youth were actually working. Now, if they migrate from that, then that will be a problem for the difficult areas.
I think it is also a question for the subsequent panelists somewhere. What sir is trying to highlight is that in spite of technology, during the rainy seasons or maybe such situations, those technological developments also do not really help. It is the bystanders or the local people who can maybe take up the responsibility of supporting during that time. But he's again highlighting one problem, that the youth is migrating, and how do we actually stop that migration so that the community is available for taking action in time where maybe even the technology is not supporting. So that could be something that can be maybe answered during the subsequent panels as well. Ma'am, I would like to bring in a question for you then. How can the medical education support this system when even technology is somehow failing during a period in the year and youth is migrating? Do you see any solution where medical education institutions can go beyond and support the system?
So just carrying forward regarding how to reach these people in remote areas during rainy season, during when they're cut off from the mainland, and the answer came in COVID. That is, we strengthened our telemedicine system because PHCs and CHCs are there. And so when the patient comes there, the nursing staff and the technical staff is there. So telemedicine actually helps in bridging this gap. And second is regarding medical education, then there are medical colleges located in the higher reaches like Almora. Now there's one coming up in Pithoragarh. So these will act as hubs for training the students in those specific areas faced in the hills. Like there's so many cases of high altitude sickness, then we have trauma cases. So in that, these students will specifically be trained, as Dr. Sharma mentioned, they are training the secondary, from secondary classes, and even in college आप train कर रहे हैं. So हमारा भी यही रहेगा कि जो हिमालयस में जो मेडिकल कॉलेजेस हैं वो इनके साथ कोलैबोरेट करें. पीएचसी और सीएचसी में जो नर्सिंग स्टाफ है, जो बेसिक स्टाफ है, उसके साथ कोलैबोरेशन में ये लोग काम करें एंड ये इमरजेंसीज हैंडल करने के लिए इक्विप्ड हो.
तो अभी आपको कोई गैप दिखता है कि वाई मेडिकल एजुकेशन इंस्टीट्यूशंस एंड द पीएचसी सीएचसीज आर नॉट कोलैबोरेटिंग टू दैट लेवल, और आर दे स्टिल फेसिंग दैट काइंड ऑफ अ प्रॉब्लम?
No, these colleges have just come up. I mean, पहले they were in the plains like Doon and Haldwani, they are in the plains. तो अभी जो medical colleges हैं, the higher areas, वो अभी आए हैं and अभी उनका curriculum in areas में strengthen होगा. So they will handle these situations. They'll be trained to handle these situations.
So your existing curriculum does have this kind of possibilities of collaboration?
Yeah, it will have. It will have. It's like the hub and spoke model. So it's very well practiced if we see in Tamil Nadu. In cardiology, basically, I'm a cardiologist, so a hub and spoke model works very well there, and that state has started it in Goa. And here in Uttarakhand, we will use it for our specific problems. We have different problems, like we have high altitude pulmonary edema and other problems which are specific to the hills. So we will use the hub and spoke model. Hub is the medical college and spokes are the primary health centers.
So in Sikkim, are you doing anything like that, practicing something similar?
Yes, madam. We have, I think, Govt has sponsored 10-bedded ICU beds to all the district hospitals, where we are dependent on this telemedicine system. But when we had a very bad natural calamity during 2011, there was a big earthquake and so many things happened. During that time, we felt that for 3 to 4 hours, there was complete shutdown of power supply, all the network, the connectivity. So for this you need network for that. So telephone was shut down. So during that period, the critical period is first hour, 90 minutes of that period. There was nothing to concern, no one was. So that is why we came up with the idea that why not we train those local people for that particular emergency. For a trained person like Madam said, there would be doctor, there are trained nurses everywhere in our country. But when the actual need arises, at that particular moment, the person living sitting, working with the community, in that community would be the first person to respond that. Because we are the medical people are the second to respond to that. So I think if we could do that, and one more thing, ASAs are empowered, they are there in the village, but during night time, I think we should again come back with one, that is just my suggestion, come back with the idea that we should have this barefoot sort of compounder sort of thing. Those people should be trained in first aid of that particular locality who do not migrate from there, but has a basic knowledge on medical emergencies. I think nowadays we are dependent so much on this modern technology that sometimes we forget the basic things. So I think why not we go with our available resources at the remote areas and villages whom actually we can depend during the emergencies to tackle the situations. So we have been doing that, trying to do that. So I think if we can continue with that, or we can get idea from others.
I think it's a very counterintuitive or paradoxical situation where we are saying that we should bring in a lot of technology to support, and seeing technology as one of the best solutions for the remote locations or hilly locations. You are bringing out points where you're saying that it has also failed due to something and the community needs to be engaged more. So, ma'am, again, coming back to a similar kind of a question what I asked you earlier, that can the medical education institutions go beyond, and your students going there is one thing, but can they be more involved with the PHCs or maybe even the local people in some way? Or do you think there needs to be some very critical inclusions or extension in the curriculum wherein these challenges can be handled by the medical education institutions?
Dr. Sharma has raised a very, very important point of first responders. Even in USA, we see there are first responders. So I think that should be a part of medical training, that the medical colleges also take the community alongside. The community which is existing in these villages to be the first responder. My only question again to Dr. Sharma, which in the discussion is, कि आप कह रहे हैं पलायन हो रहा है, and सिर्फ geriatric लोग रह गए हैं ऊपर. So how do we handle that? Because first responders also need to be, should be some younger population. So I'm just asking a cross question for my learning.
Here I can add, not only young people, because those locals who are middle-aged or those who can move. In the hills, I think all up to the age of 75 or 80, they are young only, to me. Because we move nicely, we climb the hills, we run down. We don't need the lifts to climb 2 or 3 story building. When I find many of our people coming to the hotel, they require a lift, and by then I reach my rooms through the stairs.
So, again, I think
so
it
we
boils.
cannot, I mean to say, we should not underestimate the power of the senior people also.
No, I think you are bringing out very very basic realities somehow, that we are talking bring in technology, bring in this, bring in that, but you are saying that first the local community to be engaged, and second you are saying preventive care should be better, so that at 75 also people are young, and even if the younger population is migrating, there are people to support each other. So have you all taken some practices or things that have supported preventive care?
Yes, ma'am. Now, the main thing is now we are involving the local people for palliative care. Now we are training the people who stay idle in the house or in the locality, and they have the cancer patient or terminal stages people with all the chronic diseases. Now, chronic disease is one of the killers in our society. So now they have been trained to support them. So this is one stage what we have started. And one more thing now, what our state is doing, I should mention here what it is my achievement, and this is a platform why I think I'll get time for that also. 2-3 things I'd like to mention here. And proudly I will say that Sikkim is the first organic state to be declared. We do not use any insecticide After that also now I am in the phase of, I am saying I because I am looking after the vector-borne disease. Now I am in a stage of elimination of malaria. So Sikkim is the first ODF state. That is why now I would be able to eliminate malaria because we do not have vector. Now we have almost eliminated that. Then first stage to complete the HPV vaccination to 9 to 13 years of girls. That what you call 90-70-90 technique. I think all the public health people sitting here would know this. So we have achieved more than 90% of vaccination. We have screened more than 70% of the population. Self-examination, the technique, I think madam must be knowing this. Everybody knows. And treating all those cases. So our state, what the Chief Minister has done, our government has done is, for all the cancer cases, now they are getting 5 lakhs for the treatment. Okay, so that is one area. So how can we improvise, innovate, and treat the patient, and we can extend our public health to the people, and we can gain confidence out of that also. Unless you have that technique, suppose if I am diagnosed with the cancer and I do not have other alternative for treatment, but so if I go to the population, I cannot say, okay, if you are screened, you will be given treatment. But if the system is there, the government is committed for that, and we can say our government, let us diagnose it, you will be treated in early ages, you will get the sufficient fund from there. So definitely you will get faith, you will have faith in public, they will have confidence in health workers. That is why how we can move forward, madam. So these are some of the things. And one more thing, I think every state, we want to develop an infrastructure. I want to construct a sub-center in one area. Mostly now government area is forest area. But it is taking 3 to 4 years of time to get it clear. So how can you think of a infrastructure in a periphery where you take 3 to 4 hours just to get clearance, and then how you suppose you are going to achieve your target within 10 years. So I think this is a policy matter, but I think we should strongly raise this, and at least for the health system, I think these rules or whatever is there should be relaxed for the health system. I think we should work on this also so that we can improve our infrastructure in the peripheries, madam. That is what I am feeling. This is all out of my experience I am telling here. I am sharing with all my friends here.
Ma'am, you'd like to add to it?
Well, coming to having infrastructure in the periphery, there are a lot of ifs and buts about it, because you want to build a PHC, but once clearance is given, a big private hospital also might come up, and the issue is about the forest area. It's already we are lacking behind, so there has to be a balance between the two. So they have certain guidelines, and in case it is really needed, you are given clearance. So they have how much should be the construction area. It should be 30% of the entire area you are going to build, and you have to, again, for suppose you cut so many number of trees, you have to ensure. So I think once you comply with that, the government does give clearance for building. I mean, that's what I have experienced in 1 or 2 places, yeah.
That is there, but I think I am facing that. Just I told you that what I experienced, I am telling out of that only, ma'am.
So what I can maybe summarize through our discussions right now is, one is technology is a very useful solution, but again, we need to bring in the community to support. Secondly, preventive care is something that's very, very important. And also the government should look at the state level policies, state level strategies in the hilly areas, different from what it is in the plains. Because like you mentioned that if the infrastructure clearances need to be faster, or maybe the transportation system in the hills need to be different for the medical system or the healthcare system. And as ma'am mentioned, there needs to be more healthcare training at the grassroots level, and the medical colleges could come and support in the capacity building activities, maybe even through the extension in the curriculum, and also students going to the field. So I think you both brought in some very, very good points, which will help our subsequent discussions. We have people who will be talking about how technology can help in early screening so that preventive care can be better. And also there are points wherein maybe the private partners could be brought in to strengthen the system and how we can prepare ourselves better for the trauma. So with that, I would like to conclude this.
Last sentence for the hill, people coming from the hill. Our slogan is, if we cannot do, then no one can do it. That is why in this we are working on with this theme.
So like Governor said कि स्वास्थ्य मतलब खुद का स्वास्थ्य को maintain करना is important. Thank you. With that we conclude the session.
Thank you.